Hi, my name is Hoban. I'm a GLS instructor for the Advanced Dynamic Anatomy course, and I'm part-time for the myofascial functional integration course. Today we're going to talk about a deep psoas fascial release. A lot of times this is indicated for anterior hip pain. A lot of your tricky patients where they have labral type of symptoms, labral dysfunctions. A lot of times this muscle and this fascia deep on the femoral head can actually mimic labral tearing. And there are some orthosurgeons that say that when they go in and clean out the area, they'll actually do some cleanup of that fascia to try and prevent fascial or labral fraying on the tissue. So I'll show you how you get at the muscle. So psoas muscle, you're going to start at ASIS. You can go up towards the sternum, towards the xiphoid process, but for the deep fascial release, you're going to want to go in the crease of the hip, okay? Typically, I'll have them externally rotate their hip, rest on my trunk just to keep it more comfortable. And again, usually asking, is it okay if I go reach towards the internal part of the hip, okay? Okay if I poke, okay. So you're gonna start, you can find adductor longus tendon. So go ahead and pull up. Good, you'll find the adductor longus tendon, a very taut tissue. You go just above that tendon, you're gonna fall into pectineus. So typically I'll try and get to the side of pectineus. I'm going to dive deep posterior and try and scoop underneath that tissue up towards the femoral head. A lot of times when this is limiting motion, hip extension, or causing that anterior pain, patients afterwards will move around and be like, oh my gosh, I can't believe how much less stress there is on the front of the hip. Typically it's a pretty painful palpation, so holding it for 20, 30 seconds, trying to make sure you're not there for 2 minutes, causing increased guarding in the area, okay? Kind of asking, hey, how's that feel? Does it feel like a burning sensation at all? What do you feel?
It's very tender, but yeah, really burning.
Okay. Sometimes this is really tender. Sometimes you can get an actual burning sensation. Again, 20, 30 seconds, and you're going to back off nice and slow. That way on your way out, the fascia and the muscle don't just contract, guard around you. We hope to see you at a course coming up soon.